Hi everyone, and thank you for joining my webinar today, which I've entitled Behind the Scenes. So I hope to give you a little flavour of the role of the GP. So I'm a GP myself, my name's Alison Cowan, and GP stands for General Practitioner, and a general practitioner is a medical doctor based in the community who treats all sorts of acute and chronic illnesses and refers patients to hospital for more specialised services. GPs can also specialise in particular areas of interest. So in addition to my 4 general GP clinics per week, I also deliver a weekly young persons clinic, which is there for anyone between the ages of 11 and 25. I also do a GP review clinic for the community eating disorder service once a week. And probably most importantly, I'm mum of 3 teenage girls, so I have a little flavour of the challenges facing teens currently. So what I plan to cover, rights of young people in relation to their health, and that includes confidentiality and consent and what these terms mean, and also freedom from harm. I'm going to speak about how a GP can help young people through the provision of information and advice, and also help them with any physical or mental health problems they might be having, help with transition into adulthood, and also signposting to local services. Obviously in this forum there won't be any opportunity to ask questions given it's pre-recorded, but if you are able to join the webinar live, that will be taking place on the 17th of November at 5 o'clock, then you're more than welcome to present or pose any questions then. So I want to start with a question, and again obviously you won't be able to answer this, but just encourage you to think about it. Do you think, as a young person, you can see your GP on your own and without an adult? So I'll just give you a moment to think about that. So the answer to that is yes. It is the right of every young person to speak to their GP on their own and in complete confidence, if they so wish to. Even if you are accompanied by your parents, GPs often like to see you on your own for some of the appointment too, if you're comfortable with that. Parents do know you so well that it's generally helpful to have their support and input, but as you grow into an independent adult, it is also good practice to start taking some control of your own health and feel more able to influence that and make decisions for yourself. And by having that opportunity on your own with the GP, for however long you feel comfortable, starts that process for you. And that brings us nicely on to confidentiality and what that means. So confidentiality is keeping something secret or private, and everyone, including young people, have that right to confidentiality within a healthcare setting. That means that everything you and your GP discuss together stays between you and doesn't leave the room. And that applies to all health professionals and staff with whom they work, such as receptionists or nurses. So while it's usually a good idea to involve your parents, it's up to you how much you involve them. And there are only a few exceptions to that rule. The main one being if the GP is worried that you or someone else you've mentioned may be at risk of getting seriously hurt. In order to avoid that happening, it might be necessary to involve someone else, but the GP will always discuss that with you and you can decide who together would be the best person to involve. The other instance in which the GP may feel you need someone else's help and involvement is if you're not able to understand enough about the situation to make a decision about your treatment and indeed who to involve or not involve. Another way of describing that situation is to say that you don't have the capacity to consent or sufficient understanding or knowledge to give permission. I'll elaborate more on that on the next slide. It's quite a tricky topic to cover. The final instance in which confidentiality may need to be breached would be if the law courts request information about you. But in all of these instances, the GP would discuss it with you beforehand and again decide who would be the best person to involve. So moving on to consent, which, as I said, is permission or agreement to do something. And in order to give that permission or agreement, you need to have sufficient information and understanding or capacity. to be able to. So if you're over 16 or over, you're assumed to have capacity to consent, and that's demonstrated by if you're able to understand information presented to you, you're able to retain that information long enough to make a decision, you're able to make a balanced decision using that information and communicate that decision. If you're under 16, as well as needing to demonstrate those main principles as well, there are a few additional criteria that the health professional would need to apply to ensure that they were comfortable you had the capacity to consent. And that these criteria are called the Gillick criteria, or you might hear them in reference to contraception, in which case they're called Fraser guidelines. And this is following a court case in the 1980s. Lord Fraser in the House of Lords ruled that those under 16 could be deemed to have capacity and give consent to treatment without involvement from a parent or a guardian if they were assessed to be Gillick competent. And by that they mean if the person in question, much as before, understood the information and could communicate their views, but also met the following criteria, now known as the Gillick criteria. The court case was brought about by parents of a girl under 16 who disagreed with the fact that she'd been prescribed contraception. So the guidance is in relation to contraception specifically is called Fraser guidance, but I'll list the criteria now anyway so you can get a flavour. So the first criteria is much as we said before, that the young person understands the professional's advice and risks and benefits of the treatment or whatever they're discussing. The second principle is that the young person can't be persuaded to make their parents aware. If their parents were aware, then parental consent could be given. That the young person will continue to put themselves at risk of harm if they don't have that advice or treatment. And with respect to contraception, that would mean that they might put themselves at risk of pregnancy if they don't have access to contraception. That their health will suffer if they don't have treatment, and again, the consequences of pregnancy or otherwise. That it's in their best interest to give such advice and treatment without parental consent. It's quite a tricky area to cover, but ultimately the thing to take away is that if you're under 16, then there are particular things that the health professional would need to establish to ensure that you understood sufficiently to continue to consent to whatever it was that you were discussing, and without your parents' input. So again, this might raise a lot of questions, and it is a good idea to raise them or discuss them further with an adult if you've got any concerns. I love this slide. I'll just give you a moment to read it. I feel it's very relevant to teenagers and the teenage years. The teenage years can be very challenging with all the changes that are taking place. And I see that the GP's role is to work together with you to help you grow through these challenges and enjoy your teenage years rather than just survive them. As the slide shows, help you to learn to dance in the rain and become healthy, resilient adults. We know that good health in adolescence, which is the period of time that encapsulates teenagers, we know that good health during that time leads to good health in adulthood. And the 5 outcomes of good health that the research has shown us is obviously being healthy, staying safe, enjoying and achieving, making positive contributions to society, and also economic well-being and achievement of full potential. So all very important things. So as I mentioned before, the GP's role is to provide information and advice. Just like when it rains, it doesn't mean there's a problem, which is just as well in the UK. So you don't have to have a problem to see your GP. It's part of their role is to provide information and advice. So one area that we do that in is advice as how to keep physically fit, how to maintain good sexual health, how to keep mentally fit. So physical fitness and advice. The biggest impacts we know on the physical health of young people today is around risk-taking behaviour and includes smoking. 95% of smokers will begin smoking during their adolescent years or their teenage years. Alcohol and drugs. So 94% of drug users first try drugs as teenagers, and increasingly that includes cocaine. In terms of diet and exercise, again, adolescent obesity has gone up has tripled in the last 30 years. And at the other extreme, we've recently seen a very big increase in body dissatisfaction and dieting behaviours, which can also have a significant impact on physical health and lead to more serious eating disorders. The recommendation outside of body dissatisfaction and eating disorder is to exercise for 60 minutes daily, but where there is any concern about restrictive eating or not having sufficient energy in order to exercise for 60 minutes, then that advice wouldn't stand. But for the average healthy teenager with a normal eating pattern who's having sufficient energy intake, the advice is 60 minutes of exercise daily. We're also seeing an increasing number of long-term physical illnesses appearing in the teenage years, and the role of the GP is to support teenagers in managing them themselves. So moving on to sexual health, the teenage years are also a time when sexual identity is developed, and sexual identity is establishing who you find yourself attracted to. And there are lots of changes. So again, a GP role is to empower young people, to give them the information they need and ensure that they are following safe sexual practices. During this time as well, there's a development of gender identity. So what gender, if any, you consider yourself. And I'll cover this in more detail on the following slide. So GPs can talk to you about sexual health and arm you with the information to make the right decisions for yourself. We know that 36% of 15-year-olds in the UK report having had sex, but a significant proportion of them also report regretting that decision. So empowering you with the right information is especially important. We also know that those under 16 are less likely to use contraception, and given the UK has the second highest teenage pregnancy rate in the developed world, we need to make sure you have the information and advice about contraception to prevent that. We also know that the highest rates of sexually transmitted infections are in the 15 to 24-year-old age group. So need to provide you with adequate information about sexually transmitted infections or STIs and how to prevent them. As well as chatting to your GP about these matters, you can also chat to other community professionals such as public health nurses and support workers within services for young people. You can also chat to clinicians within the sexual health services, as well as find out more information online, and I'll share all these details on a slide at the end of the presentation. So as I mentioned, we discussed teenage years as when gender identity is also established. When you're born, it's decided whether you're a boy or a girl based on the way your body looks. But for some people, looks can be deceiving and they're given the wrong gender or feel they've been given the wrong gender. No matter how someone's body looks, they might identify as male, female or non-binary. A non-binary person doesn't identify as male or female. They can identify as male and female, or they can identify as neither, or the gender can change. If your gender identity matches the one you were given at birth, then that's termed cisgender, or you're called cisgender. Gender dysphoria is the uncomfortable feeling some people get when their gender is different from the one they were given at birth. So just to go through that again, in terms of your gender, you can identify as male, female, or non-binary. Cisgender is when your gender identity matches the one you were given at birth, and gender dysphoria, transgender, is when your gender identity is different from that identified at birth, and gender dysphoria is when you're uncomfortable feeling, it's that uncomfortable feeling some people get when their gender is different. And in that instance, it's very important to talk to people, and there are plenty of resources on the Just Talk website that can support you with gender dysphoria. So moving on to mental fitness. All aspects of health impact mental health and vice versa. So mental fitness is very key in keeping generally healthy. So how we can keep mentally fit and look after our mental health well. So attending to a healthy lifestyle, so ensuring that we get enough exercise, that we adhere to a healthy, balanced diet, and have regular eating patterns, and that we sleep well. Just Talk and more widely promote the 5 steps to emotional well-being. And this highlights the first step being connect, so connecting with the people around you, being active, to keep learning. So learning new skills can give you a sense of achievement and a new confidence. Giving to others, so even the smallest act can count, whether it's a smile, a thank you, or a kind word. One of my patients once told me that she always uses the phrase, if someone hasn't got a smile, give them one of yours. Larger acts such as volunteering at your local community centre can also be a way of giving to others. And the 5th step is being mindful, so being more aware of the present moment, including your thoughts and your feelings, your body and the world around you. And there's an excellent app called Smiling Minds app, which can teach you how to practice some mindfulness and learn those techniques. And again, there's lots of resources on the Just Talk website. You can always combine a couple of those steps. Running a race for charity. I recently completed a marathon challenge with my daughter last month to raise money for 4 local mental health charities. There's a great e-learning module on the Just Talk website which covers those 4 steps in more depth, and the link is there. So as I mentioned at the beginning, the GP's role is also to support you with any health problems you might have. Whether they're short-term or long-term, or whether they're related to your physical or your mental health. The physical health problems, common ones that we see in general practice in your age group, are to do with the skin. So over 60% of young people worry about their skin, some or all of the time. Tiredness, so 1/3 of adolescents or teenagers will experience significant tiredness more than 4 times a week. Headaches, so 1/4 of young people will report headaches more than once a week. And sleep can often be quite a challenge in the teenage years. So 1/5 of adolescents reported being sleepy in the daytime. 1/4 would describe themselves as having insomnia. And 4% of those met established criteria for an insomnia disorder. So sleep results as an interaction between your body clock and processes within your body that keep you in balance. And the body clock is the result of complex sort of interactions between nerves and hormones, including the sleep-inducing hormone melatonin. And melatonin is influenced by light and dark. What we do know is that melatonin is released later in teenagers. And so often teenagers will struggle to feel sleepy enough before 10:30 at night. We know that teenagers should have about 9 hours sleep a night, ideally. So the good sleep hygiene techniques would be to have no electronics or bright lights within a couple of hours of bedtime, and avoiding large meals. A number of other things. A key issue that we find as well is that teenagers often worry about not getting enough sleep, and as soon as we introduce a little bit of worry about that in itself can make things challenging. So another strategy we employ in that instance is something called the 20-minute rule, whereby if you find yourself in your bed trying to fall asleep for longer than 20 minutes, then to get up and to do something else, quiet and non-stimulating in another room until you feel sleepy. And that way it just reduces the angst around it. In terms of mental health problems, what we see a great deal amongst teenagers is issues around stress and self-esteem. So that's reported intermittently in 2/3 of teenagers and will persist in 10% of them. We are seeing a lot of body image concerns currently, as I mentioned, and so much so that I'll discuss that in a little bit more depth on the next slide, along with the perils of social media in that regard. So as GPs, our role is to work together with you to help you overcome some of these challenges and signpost you to other services to help and continue to support you as you need. So moving on to body image. So Young Minds defined body image as being how we think and feel about ourselves physically and how we believe others see us. Body image dissatisfaction is when we are unhappy about our weight and shape, and that's the commonest risk factor for an eating disorder. Social media, we know, is to blame in part for poor body image. So research has demonstrated a direct link to the number of hours spent on social media and increased body dissatisfaction. Social media can perpetuate the thin ideal or clean eating, and often people will present themselves as experts on social media around that when the advice being given isn't healthy. The other key thing to note is that social media is not reality. And this YouTube link here, I'd encourage you to access. It's a great demonstration of how Instagram can be pictured as something that it really isn't. So I'd encourage you to have a little look at that when you've got a moment. There's also a body image leaflet that covers a lot of really good resources around body image and poor body image and how to manage it, and that's available on the Healthier Together website that I've shown there. It includes information on local resources, including COOF, national websites, and has also got links to a couple of good leaflets, one on safe binding and one on social media. As I mentioned before, GP role is also to support you with your transition into adulthood, and GPs are well placed to do that as we look after patients from the point they're born up to the point they die, hopefully at an older age, rather than at a young age. And that's why it's important that we're able to see you alone for some of the consultation to start to empower you and help you feel comfortable with looking after your own health together with the GP. It's also an opportunity to prepare you for university and sort of help educate you as to how to access support for your health. There's an excellent leaflet that's held on the Just Talk website called Thrive and Survive, which gives some good pointers in how to manage that leaving home and going to university. So as I mentioned, I was just going to run through some signposting information for you concerning general health. Obviously, as we've highlighted, GPs are a good source of information, advice and help for any problems you might have. The school nursing service is also a good source of support, and there's a great website which has some good information and advice on, as well as further signposting information. You can also text the school nursing service on Hearts Chat Health, and that's for 11 to 19-year-olds, and the number's there. Services for young people also provide a lot of information, advice and support for your age group, and they can be accessed through that link, and also they run a number of programmes to support you across Hertfordshire. The Healthier Together website contains a lot of information for young people and parents, as well as for professionals, and that's a good link to have at hand as well. And then in terms of sexual health, the Sexual Health Hertfordshire website is listed there, and contains all sorts of information around contraception, sexually transmitted infections, and how to access them, tests for them locally. There's also a national website called the Sexwise website that contains a lot of information around that as well, and the SH24 website is another very good one that you can access, and also order free sexually transmitted infection tests through the post, should you need. In terms of mental health support, I thought it was probably most sensible just to direct you to the Just Talk website, where all of the local organisations and support options are listed. And this slide here is just a summary of what the Just Talk campaign is all about, and I do encourage you to have a little look at that in your own time. It includes a number of agencies across Hertfordshire working together to support you in the best way we can. Finally, although we're not able to answer any questions in this forum, I'd just like to thank you for your attention, and encourage you, if you have any further questions based on my webinar, to email those to the Just Talk email that's on there. And remember that if you're in need of help with a mental health crisis, then to call the number again listed there, 0800 644 101, which is available 24/7, or NHS 111 option 2. And in case of any serious illness or injury, to dial 999. Thank you for your attention.